Hi, I am Dr. B.S Murthy, Director and Head of Department of Orthopedics at Dharamshila Narayana Super Specialty Hospital, Mayur, Delhi. Yeah, hypothyroidism causes osteoporosis. Osteoporosis is a rare condition where the bone becomes weak. So there are documentation that thyroid level has to maintain at correct level. So if you are taking your thyroxine as much as possible, as long as you have been taking it, please consult your endocrinologist or a physician who is treating it, and you should maintain your thyroid level and TSH level at an optimal level. Then you should be fine. Women are more prone to osteoporosis, so you should be taking care of it. Popping of knee without pain is no problem. It's called crackling knee. That is a normal, lot of people have it. But if it causes pain and sounds, that means your knees are arthritic. That means there is a cartilage rub and bone to bone touch, and it is causing pain. So I think if that is the condition with the pain and popping noise, you should get your X-ray done and show it to orthopedic surgeon, and further management can be done depending on how much of damage is there to your cartilage cap. Basically what happens is when popping sound comes, bone to bone touch, it gets irregularly rubbed off in osteoarthritis, and that causes a sound called a crepitus, and that also the nerve endings when the bone is exposed causes pain. So that happens in osteoarthritis. In that case, if you are having pain and then popping sound, you should show it to her. If there is only a popping sound, that's a lot of people have it. It's a crackling sound because of the muscle sliding on the bones. So that is okay. There's no problems. Vitamin deficiency per se do not cause any arthritis, but it causes bone to become weak. So the bone becomes weak, it deforms, it causes abnormal load on the joints, and then it might cause arthritis. But vitamin D is more important for your bone formation and bone health. So it is not directly correlated with each other. So there are no vitamins which can prevent your osteoarthritis, but maintaining your bone health is very important to prevent osteoarthritis. Your bone health, joint health depends first on the age of the patient. So younger age group, you should estimate your calcium and vitamin D. For older age group, we have one test called DEXA scan or bone density that will show us exactly how much of calcium deficiency is there in the bone. Correlate with your blood test like vitamin D, calcium, phosphate, alkaline phosphatase, and parathormone, which is an important hormone for bone formation. With this test, we can know what is your bone health and you treat accordingly. For bone density, we classify whether it is osteopenia or osteoporosis depending on the level of your DEXA scan. If it is above -2.4, then we say that your bone density is in osteoporotic zone. In that case, we give some medicines or injections to increase your bone density. That is hormones, maybe a parathormone derivative called PTH, or we can give you vitamin D injections if it is less is there, and certain medicines like which will prevent bone loss, because bone is always getting formed and also remodeling, getting out. Every week new bone comes on the joint. So bone formation we stimulate by giving these hormones and also vitamins and calcium, and prevent bone loss by giving you another tablets or injections which every 6 months you can take it. That will decrease the bone resorption, that means bone loss. And these two medicines together, either in combination or one at a time, can help you in maintaining your bone health. If there is too much of bone pain, which is a bone cry, then means there is a loss of calcium in your bones, so then you should show it to her. Multiple joint pains, or if there is deformity, then you should show it. If your knees are buckling and walking with abnormal gait, you should show it. If the pain is constant, not getting cured by any medication, then you should show it. And if your daily activities are affected by pain, then you should show yourself to an orthopedic surgeon.